So welcome everybody to our fifth webinar of the Aged Care Impact Series with Digital Health CRC. We're very excited to have you here today and give you some important updates. My name's Sam. I'm the Comms, Engagement and Events Manager here at Digital Health CRC. And for those of you who weren't at the first lot of webinars, we'll pop in a link in the chat so you can go back and watch them. They're up on our YouTube channel. I'm going to start off with a quick acknowledgement of country. In the spirit of reconciliation, Digital Health CRC acknowledges the traditional custodians of the country throughout Australia and their connections to this land, sea and community. We pay our respects to elders past, present, and extend that respect to all Aboriginal and Torres Strait Islanders peoples. Just a bit of housekeeping. This webinar is being recorded. You're welcome to pop your cameras off if you wish. And we will send around this recording along with a wrap up by Monday, hopefully. And that will have everything you need to know. We'll also use the chat function for Q&A, so pop any of your questions in there and then we'll get to them at the end. We've got ample time for that, and of course, as always, to just avoid disruptions, if you're able to just keep yourself on mute until we come into that Q&A moment. So first off, I'm going to hand over to Megan Snewen, our Senior Program Manager and Aged Care Strategy Lead here at the Digital Health CRC, and she's really responsible for driving this initiative forward. It's been a pleasure to see this grow over the last 5 months and work closely with Megan. So I'm going to hand over and you can take it away. You're on mute.
Welcome everybody. I can't believe we're on our fifth webinar.
Have you, Megan?
No sound. Is it just Sam? Can everyone else hear me?
We can hear you.
We can hear you.
Yeah, I think it's you, Sam. Oh, thank you. Okay, right. Okay, deep breaths. Tech failures. We're in our fifth webinar. We have a load of progress to share with you from the past month. I'm very excited to share it with you today. Thanks, Sam. We're going to cover off our progress and a demonstration today with all the development that's been undertaken, and that will take up the majority of the session. We'll hear a quick update on our vendor engagement, and I'll finish off talking about some testing. So that's on the agenda, but just who I'm joined by and with today. So we've got our CEO Annette Schmidi on the line and DEP CEO Claire Morgan, Isabel Freen, give a wave, who has helped leading this initiative along with me. We have joined with our development partners Beta Software, Jana and Ilya Beta, our colleagues from University of Queensland and Interray, and we have our vendor representative Leek here with us today. So lots to cover, hugely exciting times and busy times, as Sam has said. And I can see some new faces and names on the call, so I don't want to assume that everyone knows what Connexus is. So I do beg forgiveness for repeating myself here, but just a quick introduction slide in that, you know, off the back of the 5 years of research that we've done under our research project with Aged Care Data Compare with the Department of Health and our industry partners, Regis, Aged Care and CSIRO, we have invested in building a smart on-FHIR app with the Interray long-term care facility functional assessment. This app can not only do that assessment and show the quality indicators in real time to support nurses and clinicians informing care plans and interventions, but it can generate the national quality indicators as per the National Aged Care Mandatory Program. It rolls those up and can then be used to support and generate the quarterly reporting that's required and submit those through to the B2G team. So the objective of Connexus is really to demonstrate to the government the feasibility and benefits of standardising assessments in aged care, and which is why we've embarked on creating this demonstrator in Connexus. So Connexus takes and makes policy into something tangible, turning concept into practical production. So it's a pathway which we think can help reform and operationalise the standardisation of data in aged care. Over the last couple of months, we've been pretty busy, obviously spending some time at Ageing Australia, and we're inspired by the positive conversations that we've had there with nurses, providers, vendors and the like. We were also very pleased with Tracy Comans presenting on behalf of Interay and including Connexus as a basis for demonstrating the benefits that standardised data can bring to aged care. So in terms of our timeline, we're still moving with purpose and pace, and I don't want to alarm you, but by putting this slide together, I realise there's only 9 weeks to Christmas. So we've had another huge month here at the Digital Health CRC with beta, and we're just about to see all of that work demonstrated by beta. We're working towards our key date still of a late November and December showcase to multiple audiences, some private and some public. So we're still very much on track. So let's look at the activities from a development perspective that have been undertaken in the last month, and then I'll pass to Jana and Ilya to do a demonstration. Oops. Okay, so in the last month, we have finalised the QI reporting workflow and started the process with the conformance with the B2G team. And so that has been foundational, and I think you'll be really pleased to see the quarterly reporting, Sarah, today that's been generated out of Connexus. We're hoping that it supports pain points for providers. We have continued to work with our vendors. We've completed the clinical events handler, and we've started to work on our testing scope and expectations around beta testing and what that will look like. We'll continue to work on our focus now is bedding down the development and starting to verify and validate through a number of different mechanisms, which I'll cover off later. So verify and validate all of the outputs that are being generated by Connexus. So I think we've got Thomas from Lead Care here. Do you want to give a quick update just on the progress that you guys have been making?
Yep, sure. Can you hear me okay?
Yes.
Okay, very good. Yeah, so initially we started out and worked with beta on their proposed designs. Have I gone?
Yep, I can hear you.
Yeah, I can hear you.
Yep, loud and clear.
So we worked through the designs, proposed architecture and workflows, and then a plan which we've got in place. We've just about completed the authentication using Smart Launch. We hope we can have that demo ready by hopefully the end of next week at the latest. We've completed the initial data mapping for the FHIR interface, partly using custom APIs that we already had, which help with some of the mapping, so that we can pre-populate Connexus and the assessment where we have fields already available. And we're starting the build on the proof of concept for what's remaining, which we're hoping to have finished in the next few weeks.
Awesome. Thank you. Awesome. And thank you. Great to have you here today. Really happily to have engaged with Leaker. So without further ado, I'll pass to our development partner, Beta Software. Over to you, Ilya and Jana.
Hi, it's nice to present some updates. So I will be first one. So do you see my screen?
Yes.
Okay, great. Yeah. So I will start with like describing what I will go in to demo today, because it will be kind of complex scenario. So I will start with a scenario when new resident is admitted to the aged care facility. It is a completely new resident without any data. So I will create this new person. Once person created, I will create admission that demonstrates that this person is under the care in the aged care facility, and through clinical event mechanism, Kinexus will get a notification about new admission, as a result of this notification, a specific card will be displayed in the aged care software simulator. So for displaying cards, we are using a specification called CDS hooks. Yeah. Then from this pop-up notification, I will start inter-array LTCF assessment in the Kinexus and fill a couple of sections of the assessment in parallel and demonstrate how data from two sources merged in one assessment form. Yeah. After that, I perform a resident discharge, and it will trigger some additional events. I will see a new notification in the HCare software that demonstrates that discharge assessment is required. And when I launch the assessment in Kinexus through Smart on FHIR, I will see all the data pre-populated, including the discharge data. So let's proceed with a demo. I will start with creating a new resident, as I said. For today's demo, we are using characters from Harry Potter. So, yes, in here. And Medicare number. Okay. As you can see, it is a brand new resident, no medical data here, and now I will create information about admission. In a real life situation, it will not be a simulator, it will be some software like provided by Leaker or like Telstra or any other companies who is working for developing aged care software. Yeah, but since we are still in the process of setting up integration with a real solution, we are using this simulator. So let it be an emergency encounter. And let it be like 2 days ago. So information on the admission I can see on the dashboard, and it's very convenient to check that data populated in the Kinexus match data from the source system. And yeah, once I created this admission, the event was sent to Kinexus. So now I'm updating the page, and I can see this CDS card that says that assessment is due, and it's marked as an info. If I will not progress with filling this assessment in some number of days, it will be marked as warning and attract more attention of person that assessment is really need to be filled. So let's proceed with filling some data, and I will just put some random information in some sections. So for the section A, you can see that all data is pre-populated from the patient profile. Yeah, and the rest of sections are pretty empty. I will proceed to fill section C and section D. As you can see, once I enter any data into a section, it marks with green. So it is a kind of visual indication that demonstrates progress across the whole assessment. Okay, so getting back to our demo plan. So now I started the assessment and filled a couple of data. Now in the HCare software, I will add additional information. So as you can see, assessment is saved as a draft, so I can easily go back. It still sits here in the Kinexus, and you can get back to adding more data and so on, so I can easily just close it. Let's enter some data into the system. It may be data about allergies that could be entered in the HCare software or just loaded from any other sources like GP software or whatever else. Since if all the system talk FHIR and supports AU core, we can easily pre-populate data from one system to another. So I will proceed with adding all data that we for now successfully mapped into AU core. So yeah, I'm adding information about some vaccination. Yeah, so for pneumococcus it should be less than 5 years, so maybe let's choose previous year. And add also influenza vaccination. And for the assessment, it is important that it was in this year, so just a couple of months ago. Okay. Adding vitals. And finally, adding information about related person. I will add a guardian. Okay. So all the information is displayed on the dashboard, so I can check this like a high-level overview of this person. And let's proceed with filling the entire assessment. So I will continue filling the assessment that I started in the beginning of this demo. And I hope you remember that only 4 sections in the beginning contain some data. Now more sections will be highlighted because we repopulated it with additional information. So first of all, it is health condition. And since our person is a current smoker, we have this smoke tobacco daily marked yes. Next thing that we pre-populated is vitals, like height and weight. In treatment procedure, we captured information about vaccination. So there was an influenza vaccination last year, and in last 5 years there was a pneumococcal vaccination as well. Finally, since we have a related person marked as guardian, we also have it pre-populated and marked in the assessment. Yep, now I will proceed with finalizing this form. Let's choose date, and complete the assessment. Since assessment is completed, this notification should not be displayed in the HCare software anymore. So on the next update, basically it is gone. Finally, let's proceed with discharge accordingly to our plan. So resident is fully recovered and discharged, and we should see a new card that asks for discharge assessment is due. We are choosing current admission. Let's choose HK service here and complete the discharge. Yeah, so we consider data is native discharge assessment is due. So I need to fill discharge assessment. I creating a new one. And since that I have some connection issues.
Just in relation to the cards that are being shown up, Ilya, that all of those dates and the configuration around the workflow, that's business rules that we've interpreted just for the purpose of demonstration.
Yeah.
But that's all configurable.
Do you hear me now? I think it was some connection issue from my side. Sorry about that.
No, that's okay. I think the answer you were going to say is yes.
Yeah. So you asked that about like business rules behind the notification and so on. Yeah, and it is configurable. We have this flexible logic to define particular time ranges, conditions when we should show these cards, and also like type of this card. It may be like a info card or a warning card if it's something more crucial to be displayed. So I hope you can see my screen again. Yeah, because that's to show that for the discharge assessment, we have discharge section R pre-populated. Do you see my screen?
Yes.
Yeah, nice. Yeah, so as you can see, this part is filled, and once I finish the assessment, this card will go. So let's proceed with it. Yeah, I think when I just start sharing my screen, like it freezes. Yeah. Yeah. Anyway, it's like that. So now I will pass it to Yana, and I hope her connection will be better than mine.
Okay. Yeah. Thanks, Ilya. So I will be demonstrating our quality indicators reporting workflow. And just making sure that you can hear me well, you can see me well, and everything is fine with my connection. Yes? Perfect. All right, so let me start from the beginning. For those who not attended the previous webinar. So what we're doing here, there is a mandatory quality indicators reporting program that lots of facilities doing in a very resource-consuming, manual-driven, spreadsheet-based way. And we are trying to automate this process as much as possible to collect the data, to fill in the data, to send the reports via API that are provided by the Business to Government Development Portal. We got the access to the API gateway, and we got the quality indicators detailed structure over here. It's lots of information. It's different categories of the data. And we are implementing the reporting in several steps. So the first step in the system, we have an access for the care manager type of user for managing the facility and is responsible for the reporting. We have a separate section that is called quality indicators reporting over here. And it displays all statistics collected across the Kinexus application. The statistics is collected from the responses provided to entire long-term care facility assessment. Here in this page, we break down all the categories and subcategories of the data. So you can see basically details of the information collected. And you can navigate across historical data, let's say previous quarter, this quarter, and you can review the already submitted reports, or you can, if you have not submitted report, you can submit it from here. Next, what happens next? We can create new report, and this report is pre-populated with all the data that we have collected. And over the course of the past months, we've been working really hard to make pre-population as much as close to all categories fulfillment, and we've made a really good progress on that. You can see those numbers, let's say like pressure injuries, 15 out of 18 responses can be pre-populated automatically, and most of these categories of the data is pre-populated. And if you can say few elements that are not pre-populated, these are questions like tell us recipients excluded from the assessment by some reason. They're not given consent, or they're not attending the facility, or they're not being presented for the assessment. So this is the data that were not part of the entire assessment. That's why these numbers are not here. But again, the logic is also configurable. If your current aged care software can give us the remaining part of the information, this logic can be enhanced, and you can get all these calculations done as well. And three sections of the information that are not captured in the entire assessment at all. This is workforce, consumer experience, quality of life. These three items will not be filled in, but if you compare how much data are collected across these elements, these are remaining information is short, so you can enter it manually before submitting the report. And I wanted to show you a little bit of the process, how we did that. Together with the Interact team, we coordinated efforts how to basically first map data from, let me show. Map data from quality indicators to Interact, and then calculate actually the value. So we have really big database of information collected on how to calculate certain values. And for every section, etc., it was team efforts. Again, thank you very much. Try to making this happen, to putting your efforts into this. And also now we have kind of a instructions and testing manual, and for those who will be starting to use the system, for every section of the statistic, we have a description what to fill in Interact to get the numbers done, to get the output, etc., etc. And now what I'm going to show you, let's see how these statistics are being updated on flight. To make it happen, let's pick some value. Let's say I'm looking at pressure injuries, and I have the breakdown here across different stages, and I wanted to add more statistics into the care recipients with one or more pressure injuries, and will be changing stage 3 pressure injury statistic. What I need to do to update the statistic, basically, I'm gonna add more data. I'm gonna add assessment for the recipient who has stage 3 pressure injury. To do so, I'm opening again our simulator software. I'm choosing Albus Dumbledore, basically data, and launching the Kinexus. For this resident, I have already assessment going on, and I will be editing it. The pressure injury information I can find in skin condition section, and I can add pressure injury on the stage 3. Basically, I'm adding new response here, and I'm saving the assessment. Yep, and I'm updating the statistic information. Yeah, and you can see that stage 3 was 1 resident, and now it's 2. So you can see that all statistics are calculated on the fly, and every piece of information you are adding to Kinexus is calculated here, and you immediately can add it to your report. Basically, it is here. And if you like, I'm not going to complete this new report because it's lots of data that I need to like add, but I have draft report over here. Like I just created it this morning, and I can perform this section. Basically, when I need to submit some report to the portal, I'm doing like sending action, and I'm receiving the like updated status. This part, like right now, our next step is test this part with the statuses, handling all the errors and making sure that this last mile with B2G portal works in a stable way. We can rely on it, and this is like work in progress, but the mechanism already here, the workflow is already here. We will be finalizing it as our top priority till the next webinar. So I think that's it from the presentation on my side. On into Megan.
Thanks, Jana. I just wondered if there was anything else Ilya didn't cover. I'm not sure. But I think we're all good. Okay, thanks, Sam. That was fantastic. I'll just pause now to reflect on the amount of effort. I know we were sort of looking through a spreadsheet there with all the inter-eye all the inter-eye questions mapped and generated with calculations for the national quality indicators. That is heavy lifting and a massive amount of work that's undergone there. So congratulations to you and the team. We're really pleased, but we're also we really value the input that we've had from our inter-eye colleagues and the team at UQ in terms of that work. So the validation of Kinexus, as I said, will take several different streams. We will obviously have a technical stream, which will involve the beta software doing the system test and other vendor testing through LeeCare and other vendors. We will also validate the Smart on FHIR functionality and FHIR implementation guide. And the other 2 main areas that we have in terms of our testing is usability. So we'll be looking at feedback on product features, on process flow, assessing the fit in relation to the workflow of residential aged care providers, and identifying or validating the user stories as they are, or identifying new or missing functionality, gathering feedback on usability, and documenting benefits. So the other bit, as I said, that's fully underway and happening in 2025 is validation of the implementation of Inter-Ray, which is happening through Inter-Ray Australia and internationally as well as the formal sign-off. The generation of the quality indicators from Inter-Ray, so the standards being mapped through all the way. The validating the quality indicator report, so as generated. So that will get sent off through B2G conformance. And as Jana said, we're looking at now testing our statuses with that and sending that back into the system when the B2G submission has happened, and then gathering feedback on scalability from users. So there's a lot happening between now and the end of the year for validating and verifying what we are doing, and how we go about doing that in 2026, more formally putting through the implementation guide through its paces. So current status of artifacts on foot, I think, and I've covered a lot of this. The B2G stuff, the system test is nearing completion, and we haven't started conformance, but we are well on the way to doing that. So good to have Carmen. I think you've rejoined, which is great to have you here. You'll be pleased with that progress. And the other two main areas of validation are the calculation of the QIs and the Australian version 10 of the InterEye long-term care facility. Good to have your reflections in the chat, Sarah. Would welcome any other provider feedback on the call of the B2G quarterly reporting, the quality indicator quarterly reporting being generated like that. So I think we are ready for Q&A, Sam. So before we open up, just giving you a warning, Isabel and the beta team about the question and answer session. All of the information from today's session will be sent via email to anyone registered. I know that we've had a few ins and outs with the sound today, so hopefully the summary that we send and the copy of slides will help if you have missed a little bit, and we will, Sam will post a recording. So over to you, Sam, for Q&A.
Thanks, Megan. I hope you can hear me. I went pretty much the whole time with sound, so I was reading the little transcript below, so thank goodness for Copilot. If you do have any questions, you're more than welcome to come off mute. Just raise your hand and we'll come to you. Sarah.
Just going to do it.
Thanks, everybody.
Go ahead, Sarah. I was the person asking the question, and I think, you know, this is a really critical. This is, as I said, you know, we've developed the electricity. The light bulb is when it, you know, it hits the workplace and people can see the value of the work, you know, what's gone on in creating this, you know, amazing tool.
Yeah, I think, as I put in the chat, that the whole B2G will be a massive time saving. We've got a team just at the moment who have just finished the submission, and it's taken days to compile into Excel spreadsheets and then upload. And there was initial challenges with the upload to government that they had to work out something in the spreadsheet was wrong. So something like this, I can't tell you how massive it would be. The cost saving to then give time back to the floor will be quite huge. My question, and it's only because I haven't quite wrapped my head around using the InterEye assessment form. So if we've got a resident who comes in and we start all of our assessments, not all of the assessments will meet InterEye, we know that, but we open up Connexus, it pre-populates, then we might go through and finish everything over whatever the time frame is. What happens then when we are updating assessments and making changes? And I'm thinking really also of ADLs. How does Connexus then identify that? Does it overwrite, or do we need to complete that InterEye assessment and start a new one? I'm just thinking through that workflow.
Ilya, have you got sound?
Yeah. I will not turn my video on. Maybe if I just go with sound, it will be better. Yeah. So regarding the repopulating form in the process of filling it in the Kinexus Smart File application. So if a field, if some value was entered in the assessment, it will not be repopulated. But by default, all fields are empty. So empty fields will be repopulated. So for my particular example, like I demonstrated how smoking status field was repopulated from the HCR software. But if processing the during the filling assessment, I would go to this question and answer, for example, no. In this case, it will not be changed because, like, we decided that if person enters some data in the assessment, it is done for a reason, and we are not going to override it. We only fill empty answers.
Yeah.
Automatically.
And I think, Sarah, if that is a valid, if it's a valid user story, then we need to consider having a workflow or a prompt which would say, these are the fields that are updated. Do you want to accept this additional new data? And so that's why we're really keen to get feedback like this, because we hadn't considered that.
Yeah, because there's
Actually,
yeah.
may I say just a couple of words here. We, in fact, have the scenario that covers situation like this. You can create new assessment, saying like routine reassessment or change in health reassessment. And if you have previous assessment, all previous answer except for certain categories will be refilled from the assessment, and some certain fields that we consider like primary information in HTS software will be pre-populated from this software, and you will be entering only like little delta of it. You don't have, you will not have to create it entirely from scratch. So this scenario also exists, and we are very much looking forward to the testing phase, so to get your feedback on this scenario.
Yeah, I think it'd be great to map through a few scenarios. There's obviously some information that will never change, date of birth, for instance, but as residents decline in health, there are fundamental assessments that are going to change that would need to also be picked up on future quality indicators. So a quality indicator 12 months ago might have been this, but now we will have updated an assessment because of declining health. And is that a new inter-I form then that we're using, which I'm assuming would be yes. Yeah, thanks, Jana.
Yeah, and I think also there are some rules, Sarah, that we have interpreted for the inter-I implementation, which they're quite rigorous around what data gets updated and what data can be persisted in terms of, say, date of birth and things like that. So it's not just it needs to be a prompt to the user in terms of the way, you know, and you've probably had more training than me in the inter-I assessment, but it's there are some strict guidelines around how it gets implemented. So, but that is one of the use cases that are the user stories that we will be covering.
Cool. Thank you.
There's no other questions in the chat. If anyone else has anything, I think Annette, do you want to say something?
No. I had my question answered, Sam. I mean, you know, certainly that's the really vital aspect of this, the work, that impact that it's going to have in terms of, you know, taking what has been a manual process and creating a, you know, digitizing it in a way that's going to save people and create a lot of, you know, other opportunities for that time saving to be directed back to patient care, which, as we know, is one of the biggest reasons people give for leaving their roles in residential aged care, is the time they spend doing administrative tasks rather than, you know, looking after the residents.
Agree, Annette. And I think if I just bang on very quickly, a secondary outcome is going to be the improved ability for staff to undertake assessments because they're using the Inter-Eye system. So I think that there will be education that will be needed around that. I think we all know that, but I think that's also a massive secondary outcome of this.
Thanks, Sarah. I'm not sure, Isabel, if you wanted to have any closing remarks. Otherwise, I think we can. I'll pass to Sam to close, and hope that you've seen on the last slide the QR code for our next webinar in November.
Well, yes, there we go. I will close off.
Yeah, no, great
I think,
work,
like
fabulous.
I said last time, it's been great to see the progress, and of course, as a fellow RN as well, being in the HCS space quite a bit, it's nice to sort of see this all coming together, and I can definitely see that it's going to have an impact in the aged care sector. So it's all very exciting. We do invite you to the next webinar in November, and we hope that we'll see you there, and thank you all for attending today.